What if the blood pressure target your doctor gave you is actually dangerous for your body? I know that sounds dramatic, but stay with me here. Because a 2023 analysis published in JAMA Internal Medicine found that aggressive blood pressure lowering in adults over 60 were talking broken hips, head injuries, emergency room visits that could have been prevented. Here's what makes this both fascinating and, honestly, a little frustrating. The guidelines say one thing, but your body might be telling you something completely different. And if you're not listening to your body, you could be chasing a number that's actually hurting you. I just see this happen too many times. Comes in feeling terrible, dizzy, exhausted, graying dogs so thick they can't remember their grandkids' names. But when I look at their chart, their blood pressure looks perfect on paper, 118/72. Textbook normal. But for their body, at their age, with their specific physiology, that number is way too low. So today, I'm going to show you something most doctors don't have time to explain. The personalized blood pressure frameworks that could change everything about how you manage your health. We'll cover what the two most important blood pressure studies actually mean for you specifically. The warning signs that your target is too aggressive, and the exact ranges I use with my own patients based on their individual situations. Before we dive in, I want to hear from you. Drop a comment with your age and your most recent blood pressure reading. I read every single comment, and it helps me understand who's watching so I can make better content for you. And of course, everything I share today is backed by published research, but always work with your healthcare provider before making any changes. Your individual situation matters. All right, let's start with the biggest myth about blood pressure that almost everyone believes. Most people think blood pressure is simple. There's a normal number and a high number. You're either in the safe zone or you're not. Green light or red light. But here's the truth that took me years of clinical practice to fully understand. Blood pressure is one of the most personal numbers in all of medicine. Two people can have the exact same reading and face completely different risks. Let me explain what I mean. Your blood pressure number tells you what category you fall into. Normal, elevated, stage 1 hypertension, stage 2. But those categories don't tell you whether your brain is getting enough blood flow. They don't tell you whether your kidneys can handle your trite medications. They don't tell you whether lowering that number further will help you or hurt you. That depends on factors unique to your body. How stiff your arteries have become over the years. Whether you're experiencing symptoms like dizziness or fatigue. How many medications you're already taking. Your kidney function. Your cognitive health. Even your activity level plays a role. This is why blood pressure management after 60 becomes more art than science. And it's why the one-size-fits-all approach fails so many people. Now, there are two landmark studies that every person over 60 should understand. Not just the headlines, the actual details. Because the details change everything. The first is the SPRINT trial. Published in the New England Journal of Medicine in 2015. This was a massive study. 9,361 adults over age 50 with an average age at 6'8". The researchers split them into two groups. One group aimed for an intensive target of less than 120 systolic. The other aimed for a standard target of less than 140. The results made headlines around the world. The intensive group had fewer heart attacks, fewer strokes, fewer cardiovascular deaths. The medical community celebrated. Finally, proof that lower is better, i.e. alternative version. But here's what almost nobody talked about. That same intensive group also had 30% more dizziness, 40% more episodes of passing out, significantly more electrolyte problems, more kidney complications. and more falls. They meteoriscored you. Think about that for a moment. You're avoiding a heart attack, which is wonderful, but your blood pressure is so low that you pass out, hit your head on the fountain floor, and end up with a brain bleed. I've seen it, Captain. It's devastating. Let me tell you about Dorothy Hendricks, a 74-year-old retired librarian from Minneapolis. Dorothy came to my office 3 years ago, frustrated and scared. Her previous doctor had put her on 3 blood pressure medications to get her under 120. On paper, she looked perfect. 180/70. But Dorothy felt terrible. She couldn't walk to her mailbox without holding onto the fence. She'd stop driving because she felt lightheaded behind the wheel. Her grandson's birthday party was coming up, and she was terrified she'd fall in front of everyone. When I reviewed her chart, I saw something her previous doctor had missed. Her standing blood pressure dropped to 92 when she got up from sitting. That's called orthostatic hypotension. Her brain wasn't getting enough blood when she moved. We slowly reduced her medications over 8 weeks. Her blood pressure settled at 132/78. Look as impressive on paper. So within 3 weeks, Dorothy was walking around the block again. She drove herself to her grandson's party. She told me later, with tears in her eyes, "I feel like myself again." Dorothy's story illustrates something crucial. The Sprint trial excluded people like her. The trial didn't include anyone with diabetes, anyone who'd had a prior stroke, anyone with dementia, anyone with advanced kidney disease, and anyone with severe frailty. In other words, Sprint tested aggressive blood pressure targets only in the healthiest, most resilient adults, not the general population. Not the people who might actually struggle with those targets. The second major study is the STEP trial from China, published in 2021. This one enrolled 8,511 adults aged 60 to 80. Similar design to Sprint, intensive target versus standard target, and similar results. Fewer cardiovascular events in the lower blood pressure group, but also more side effects, more dizziness, more kidney strain, more fainting episodes. Here's what these studies actually tell us when you read them carefully. If you're over 60, walking regularly, highly independent, cognitively sharp, with healthy kidneys and minimal medications, the cardiovascular protection could be worth it. But if you're over 60 with multiple medical conditions, taking 4 or more medications, dealing with kidney issues, that might absolutely be dangerous. So how do you know if your current target is too low for your specific body? Your body gives you warning signs, clear signals that something isn't right. And if you're experiencing any meal, it's time to have a serious conversation with your doctor. The first warning sign is lightheadedness when you stand up. Not a brief head rush that passes in a second. I'm talking about that feeling like you might actually pass out, where you have to grab something to steady yourselves. A 2020 meta-analysis in the journal Hypertension found that orthostatic hypotension affects up to 30% of adults, and it doubles the risk of falls. The second warning sign is morning dizziness. If you're waking up feeling unsteady or off-balance, your overnight blood pressure may be dropping too low. Your brain needs consistent blood flow, even while you sleep. Third is brain fog, difficulty concentrating, forgetting words mid-sentence, feeling like you're thinking through mud. When blood pressure drops too low, your brain literally isn't getting enough oxygen-rich blood. The cognitive effects can be profound. Is persistent fatigue. Not the normal tiredness after a busy day and you exhaustion that doesn't improve with rest. Your cells need adequate blood pressure to receive nutrients and oxygen. Too little pressure means too little fuel. Fifth is feeling unsteady on your feet. That sensation of being a little off balance all the time. This dramatically increases fall risk, which is one of the leading causes of serious injury in older adults. Sixth is muscle cramps or electrolyte issues. Many blood pressure medications affect your potassium, sodium, and magnesium levels. When these get out of balance, cramps and weakness follow. And seventh, if your blood pressure regularly dips below 100 systolic, especially when standing, that's your body saying, this is too low for me. Let me share another story. Harold Washington, 81 years old, retired postal worker from Atlanta. Harold's daughter brought him to see me because he'd become a different person over 6 months. Confused, withdrawn, sleeping 14 hours a day. His previous doctor thought it might be early dementia. His blood pressure at the appointment was 112/68. Looked funny. When I got him to stand up and checked again, after 3 minutes, it dropped to 88/52. His brain was being starved of blood every time he moved. His medication list told the story. 3 blood pressure drugs plus a water pill, all prescribed with good intentions. But his body couldn't handle that level of suppression. We eliminated one medication completely and reduced another by half. Within 4 weeks, Harold's blood pressure stabilized at 138/74. His daughter called me crying. She said, I have my dad back. He's telling jokes again. He's playing cards with his friends. Harold didn't have dementia. He had over-aggressive blood pressure management. This brings us to the framework I use for nearly all my patients. And I want to be clear, this isn't a substitute for your doctor's advice, but it's a starting point for an informed conversation. If you're 60 to 79 years old, active, independent, and don't have significant chronic condition, aim for less than 130/80. This balances cardiovascular protection with quality of life. If you're 60 to 79 but dealing with dizziness, frailty, multiple medical conditions, or taking multiple medication, this is still protective but gives your body more room to function well. If you're 80 or older, the target range widens to 130 to 150 systolic, depending on your symptoms. At this age, avoiding falls and maintaining cognitive function often matters more than hitting an aggressive number. Now here's the nuance. If you can tolerate 120 or lower without any side effects, no dizziness, no fatigue, but only if you feel good, the number means nothing if you can't live your life. Let me explain why blood pressure becomes so personal as we age. It has to do with what's happening inside your arteries. When you're young, your arteries are flexible. They expand and contract with each heartbeat, smoothing out the pressure waves. But over decades, those arteries gradually stiffen. Calcium deposits build up. The walls become more rigid, like a rubber band that's dried out and lost its stretch. This stiffening changes everything about how your body handles blood pressure. A younger person's arteries can absorb the impact of blood pressure medications. An older person's stiff arteries can't adapt as easily. The pressure drops may be sudden and dramatic rather than smooth and gradual. This is why the same medication at the same dose can work beautifully for a 50-year-old and cause serious problems for a 75-year-old. It's not about the dread. It's about the arteries it's working with. The Sprint trial researchers published a follow-up analysis in JAMA Internal Medicine in 2016. They looked specifically at participants over 75. What they found was striking. The benefits of intensive blood pressure lowering were smaller in this older group, and the risks of adverse events were larger. The older you are, the more cheerful you need to be. So what should you actually do with this information? Let me give you a practical framework. First, know your standing blood pressure, not just your sitting blood pressure. Have your doctor or nurse check your pressure after you've been sitting for 5 minutes. Then stand up and have them check again after 1 minute and 3 minutes. If your systolic drops more than 20 points or your diastolic drops more than 10 points, you may have orthostatic hypotension. That's important information for setting your target. Second, keep a symptom diary. Write down when you feel dizzy, tired, or unsteady. Note a time of day and what you were doing. Look for patterns. Many people feel worse in the morning when blood pressure naturally dips. Others feel worse after meals when blood flows to the digestive system. Third, review your medication list with your doctor at least twice a year, whether every medication is still necessary. Ask about timing. Some blood pressure medications work better in the evening. Others are better in the morning. The time you can make a difference. Fourth, understand that blood pressure varies throughout the day. A single reading at the doctor's office doesn't tell the whole story. Phone monitoring gives you much more information. Check at the same time each day after sitting quietly for 5 minutes. And fifth, advocate for yourself. If you're experiencing symptoms that affect your quality of life, speak up. Your doctor may not realize how much that dizziness is impacting you unless you tell them clearly. Let me give you the exact words to use. Tell your doctor, I want to understand my personal blood pressure target. Based on my age, my other conditions, and how I'm feeling, what range should we aim for? And is there room to adjust if I'm having symptoms? That one question opens the door to a real conversation. Most doctors want to personalize care. They just need to know you're ready for that discussion. Now, about medications specifically. If you're on blood pressure medications and experiencing symptoms, don't just stop taking them. That can be dangerous. Instead, work with your doctor to adjust slowly. The medical term is titration, reducing doses gradually over weeks, not days. A 22 study from Mayo Clinic looked at 1,200 patients over 70 who reduced blood pressure medications under supervision. The protocol involved reducing one medication by half every 4 weeks while monitoring closely. 91% successfully reduced their medication burden without their blood pressure becoming dangerously high. The key was doing it slowly and with monitoring. Here's something else most people don't know. The time of day you take your medication matters more than you might think. A 2019 trial called the Hygia chronotherapy trial, published to the European Heart Journal, followed over 19,000 patients for 6 years. But they found that taking blood pressure medications at bedtime instead of morning reduced cardiovascular deaths by 45%. Why? Because blood pressure naturally drops at night. Taking medication in the morning can cause your nighttime pressure to drop too low. But taking it at bedtime helps control the early morning surge when both heart attacks and strokes occur. Now, this doesn't work for everyone. Some medications cause nighttime urination that disrupts sleep, but it's worth asking your doctor whether your medication timing could be optimized. One more practical tip. Caffeine and blood pressure have a complicated relationship. Caffeine can temporarily raise blood pressure by 5 to 10 points for about 3 hours. If you're checking your blood pressure at home, avoid caffeine for at least 30 minutes before measuring. And if you're trying to hit a target number, know that your morning coffee might be artificially inflating your readings. Now, I want to take a moment here. We've covered some heavy information today. Numbers, studies, warning signs. It might feel overwhelming, but here's what I need you to understand. You're not powerless. You're not at the mercy of a guideline that wasn't designed for your specific body. And you're definitely not alone in navigating this. Remember Dorothy from earlier? The retired librarian who couldn't walk to her mailbox? I talked to her last month. She's 77 now. She volunteers at her local library 3 days a week. She walks 2 miles every morning with her neighbor. Her blood pressure runs around 134/76. It's not textbook perfect, but perfect for her. She told me something I'll never forget. She said, I spent a year feeling like I was disappearing. Now I feel like I came back from somewhere far away. And Harold? The 81-year-old whose daughter thought he had dementia? He celebrated his 83rd birthday last spring. His daughter sent me a video of him dancing at the party. His blood pressure runs around 136/72 now. Not guideline perfect. But Harold, perfect. These stories aren't unusual. They're what happens when we stop treating numbers and start treating people. You know what keeps me going in this work? It's not the perfect blood pressure readings. It's the phone calls I get from adult children thanking me for giving them their symptomatic. It's the patients who tell me they finally feel like themselves again after years of feeling off. That's what personalized blood pressure management can do. It's not about hitting an arbitrary number. It's about finding the sweet spot where your heart is protected and your life is still worth living.